The broadcast is now starting. All attendees are in listen-only mode.
Hello and good afternoon, everyone. And thank you for participating in today's webinar, Navigating the Impact of COVID-19 on Juvenile Justice Policy and Practices, which is being presented in partnership between the Council of Juvenile Justice Administrators and the Center for Juvenile Justice Reform. My name is Mike Dempsey, and I'm the Executive Director for the Council of Juvenile Justice Administrators, formerly known as the Council of Juvenile Correctional Administrators, CJJA. I think it's important to begin by acknowledging the webinar discussion will be Michael Lempier. Michael is the Director of the Center for Juvenile Justice Reform, where he's responsible for overseeing all of CJJR's programs, initiatives, research, and operations. Prior to becoming Director in 2020, Michael served as CJJR's Deputy Director of Juvenile Justice System Improvements and Communications, where he managed the Youth in Custody Practice Model Initiative, served as a trainer and provider of technical assistance for juvenile justice system improvements projects, crossover youth practice model, and the multi-system collaboration training and technical assistance program, and served in other leadership capacities, including with the Juvenile Justice Leadership Network and Public Information Officers Learning Collaborative. As presenters today, we also have with us Heidi Mueller, who is the Director of the Illinois Department of Juvenile Justice, overseeing the care, custody, and services provided to youth committed to the Department of Illinois Juvenile Courts. In this role, Director Mueller oversees 5 secure youth centers and 8 aftercare juvenile parole offices, along with 5 day reporting centers located throughout Illinois. Mrs. Mueller was previously named Deputy Director of Programs of the Illinois Department of Juvenile Justice in 2014. In that role, Ms. Mueller served as the principal policy-making official for all department's programs, including healthcare, behavioral health services, vocational, and recreational programming. We also have with us Inez Nieves. She has over 39 years of experience working in the juvenile justice field in different capacities. She was responsible for the operation the largest facility of juvenile delinquent girls in upstate New York. She has received national recognition for her work with female offenders and gender-specific programming. She has facilitated national workshops and has been a consultant for the National Institute of Corrections, the American Correctional Association, and other states. She currently serves as the Northeast Regional Director of the Council of Juvenile Justice Administrators. Presently, Ms. Nieves is the Deputy Commissioner for the Division of Juvenile Justice and Opportunities for Youth in the New York State Office of Children and Family Services. She has been instrumental in implementing legislation regarding raising the age of criminal responsibility for juveniles in New York State. Lastly, we also have with us Brett Peterson, who is the Director of Juvenile Justice Services. He is responsible for the operation and management of the continuum of care, including early intervention, shelter, detention, and long-term secure settings. As director, Brett is committed to reducing the need for out-of-home placements, correlating the services provided with the leading research related to adolescent brain development and ongoing establishment and implementation of significant juvenile justice reforms. This focus has enabled Utah to close secure beds, shift significant resources to community non-locked settings and implement a comprehensive front-end service array. Brett began his career with the Department of Human Services as an in-house assistant attorney general, where he worked with youth residential providers and staff to reduce silos and improve access to services. I want to thank you all again for joining us on today's webinar. And with that, I'm going to turn it over to Michael to get the discussion started.
Great, thanks so much, Mike. And I want to echo your remarks in welcoming everyone to this important discussion. As we know, COVID-19 is having profound implications on juvenile justice policy and practice. Systems and agencies all around the country are currently in the midst of navigating this pandemic, and some agencies and systems are being directly and significantly impacted on a personal and professional level with staff, young people, families, loved ones testing positive and suffering from this virus. Other systems and agencies around the country are bracing themselves for those possibilities as well, implementing preventive measures and thinking about how those agencies and systems can best respond. In the face of this environment and all these challenges, we felt that here at Georgetown and at CJJA, one of the best things that we could do is to continue to provide a forum for discussion for the field, for those working the front lines, who are working to keep young people and families safe, who are working to keep their staff and community safe, all in an effort to support one another, to share ideas, to talk about promising strategies. And that's precisely the purpose of this conversation today. That's what we'll be doing. We'll be exploring agency-wide and system-wide implications of COVID-19, thinking about what is happening at the facility level and at the community level as well. We do intend this to be an interactive experience. While we won't be opening up the lines to the 1,000 attendees that we have on the webinar currently, we do ask that you all submit your written questions, as there will be a significant portion for Q&A at the end of the webinar. Here on the screen, you see, depending on your operating platform, exactly how to do that. Essentially, you'll have to look for the questions box on your screen. As the conversation unfolds, please do not hesitate to submit your questions. This webinar is being recorded, and we do intend to share it with the field after the presentation. And to the extent that we're not able to address every question on the conversation today, we will do our best to follow up in writing after the webinar so that we can provide as much support as possible. So with that, I'd like to launch into the conversation with our wonderful leaders in the field. And I want to just recognize that you all, the three of you all, and your counterparts in your respective agencies are currently in the midst of this incredibly challenging work. And for you all to take the time to contribute to the field, to share your thoughts, to provide your support is most appreciated. So at the outset, let me thank Heidi and Inez and Brett for taking the time to be with us today. I know that your insight is most appreciated by everyone, and we look forward to the discussion. At the outset, what I'd like each of you to do, just so that everybody understands the context and the background of your respective systems and agencies that you manage, if you could share a little bit about that background, describe the kind of scope of services that your agency provides to young people and their families and communities, and then talk a little bit about what you're currently facing with respect to the COVID-19 pandemic. What are some of the biggest challenges that your agency is currently facing in the midst of this crisis? So with that, let me turn to Heidi from Illinois. I'll start there. Again, Heidi, if you could give a little bit of background on your department and talk a little bit about what you're experiencing and some of the challenges that you're seeing.
Sure. Thanks for having me on, and thank you, Michael. Hello to everybody, and I'm just wishing health and wellness and just all my positive thoughts to everybody out there. I am the director of the Illinois Department of Illinois. We have we have 5 located throughout the state.
Heidi, if I could just interrupt for 1 second, you're coming in a little bit choppy on my end. Folks from CJJA, can we troubleshoot the audio?
Hey, can you do my
Hey, Michael, I think you're right. It was breaking up on my end as well.
Okay.
There
Do
you
you
go.
want me to? Do you want to go to someone else and have me try calling in?
Well, I'm getting to just Heidi that it's not choppy for everyone, so perhaps you should go continue.
Go ahead. Okay. So as I was saying, we have 5 secure facilities throughout the state of Illinois. We have 8 aftercare offices that are located in communities throughout the state. And we provide services and supports and case management for kids who have been adjudicated delinquent by Illinois courts and committed. And then we also have community-based supervision and support for those kids after they're released from secure custody. We also have a portion of our youth in custody, our youth who were sentenced adults in criminal before the age of 18 come to us and period of time but at the age of 18 they're eligible to transfer to adult Department of Corrections. So, we're at with today, our population is actually 7 youth, 30% deep. Since I think we'll
So
kind of significant
issues.
I see your mouth.
During the connection, go ahead and move to Brett. And in the meantime, Heidi, let's try to figure out audio to get a better to call in phone. If you've called computer audio, we're just not getting. Turn to Brett. Brett, if you could give us a little bit of background on your agency and some of the challenges that you're experiencing.
Can you hear me okay, Mike? All choppy? Oh, you can hear me? All right. I hate asking that on a webinar, but so far I've had quite a bit of chop, it sounds like. So on a high level, so our system, what we look like is we cover everything through the continuum. So everything from early intervention, school-based outreach, detention, as well as long-term secure settings, case management, and parole. I couldn't tell if you asked the question of what our biggest challenges were at this point. Okay. Very good. So I think the largest challenge for us, what we've been navigating systemically, we are doing an amazing job. And I feel really, really lucky in Utah for the degree of the impact at this point and also our response. I feel like as a state, we were fairly ready. As some of you might have recalled, our second day in, well, kind of about second day-ish into COVID, we had a pretty significant earthquake as well. So the good news with that, with the earthquake, was we were already in kind of that command team mode. And so like our emergency protocols were already in place. It wasn't that difficult, but it did kind of heighten some fears with our youth and with our staff. That's the biggest challenge. It's the fear of, and it's not a new challenge. It's a challenge every person who operates systems that's in any kind of leadership looks at and deals with, which is this fear of change. And this is an incredibly fluid situation. It's coming at us different every single day, different challenges each day. And so helping our staff stay grounded, helping, starting with myself, that's the number one thing that I can impact, is ensuring that I'm looking to self-care and looking to stay calm, to breathe, and then to try to help that trickle down through our teams. And I have so many great leaders across the state that are doing that, but that's been our biggest challenge, honestly, is just that fear element. So the good news is that the response is something that, we can kind of see. It's not this, a larger issue. The bad news is that type of an issue in a system and change it takes time, and it's really kind of it takes a good culture, and it takes a commitment to kind of transparency with our staff to help them see, look, here's what we're doing, here's the direction we're going. So those have been our biggest challenges, Mike.
Thanks, Brett, for that. Go ahead, Heidi.
I was just going to say, can you hear me now? I'm on.
Yes.
Okay, should I go next?
Yes, please.
Okay. So I had started talking about just our system a little bit, and I'll skip over that, I think, and just jump into where we're at. I think for us, given the kind of outbreak status, particularly in the Chicagoland area, we have 3 of our 5 facilities, secure facilities, are in the Chicagoland area. A number of our aftercare offices and the majority of our staff are located in that area. And so for me, some of the biggest challenges were, initially kind of getting in front of it and making sure that we had a really good plan to respond as things changed, as things grew. We were also really fortunate in that I believe we had a very proactive and forward-looking administration here in Illinois who took a lot of actions right away, and kind of had the whole team of cabinet members working together to plan. So we were able to really coordinate with our emergency management agency and our Department of Public Health and kind of put in place a lot of operating procedures right off the bat. And again, just like Brett said, I had a phenomenal team of folks who were working on that and really just kind of getting things in place right away. One of our biggest challenges was really trying to make sure that we were in front of things enough that we could avoid an outbreak in one of our facilities, particularly in the Chicagoland area where we're seeing a larger spread. And of course, just keeping my staff safe, keeping the kids safe, those have been kind of my number one priorities. I think the fear piece has also been a challenge for us. It's a really stressful time. It's stressful for the employees. It's stressful for the kids. It's stressful for families. With visitation being cut off, that adds extra stress and anxiety for our kids. And so really just trying to think about creative ways that we can continue to keep the youth calm and engaged but also keeping the staff feeling supported and calm is a huge challenge that, you know, we work on every single day.
Great, thanks Heidi for that. And I do want to get to the staffing piece and specific strategies that you're focused on to speak to that staff anxiety and staff well-being. But before we do that, let me turn to Inez for your thoughts about some of the biggest challenges that you're seeing in New York. And Inez, I believe that you're on mute.
Thank you. Thank you all. I knew I would do that. First of all, let me thank you for giving me the opportunity to participate in this webinar. As you know, New York State is the epicenter of this health crisis. So we've been going through some tough times. I'd just like to take a quick opportunity to thank my staff. People are heroic. That's how I can describe them. Coming to work every day, working with the young people. And our biggest issue right now is containment, making sure that this virus doesn't spread throughout our facilities. The other thing is that COVID is an evolving crisis. So we are constantly under the guidance and direction of the New York State Department of Health and also the governor's office. So things changed every day in terms of practice. And people can get frustrated in the field when they're waiting for an answer and they don't have an answer. And, you know, we continue to work very closely with our facilities. We also, staffing is one of the major issues in our facilities. Our teams are, in terms of our aftercare teams, they are in the communities. They are working remotely, but we are dwindling in terms of staffing. And let me just give you a quick status in terms of New York State and how this virus has impacted us. Sadly, we have lost two colleagues, two veteran employees, Curtis Whitted and Nazir Kebrew. This has had a great impact on our facilities and on the DJ Joy family. Overall, New York has had over 10,000 deaths. So many of our staff are also sort of like impacted because of lost relatives and friends. 36 of our staff had tested positive in our facilities for COVID. At one facility, there are 25 staff that have tested positive. Again, there's exposure, so there's actually 56 staff out at that one facility. Many staff are quarantined and waiting to be tested. Across our facilities, we have probably about 28 under investigation for the virus, 54 that have had contact with other people that have had it. So it's really, you know, stressful for the people that are left behind because there are, you know, vacancies and overtime and things like that. And they are also worried about their own families. On the positive side, as we have tackled this virus, 5 facilities have had very little impact. We have 12 facilities across the state. 4 are under what we call control status. That means they've had some positives, but they are pretty stable right now. And 3 are of great concern in terms of the COVID impact on positive staff and also the staffing. No youth have tested positive so far in New York State. We have 2 right now that we are currently waiting for the testing. But we have aggressively tackled the situation across the state. We are constantly putting in new procedures. We are very aware that, you know, the personal protective equipment, the burn rate is high. So we're constantly, you know, doing a Pony Express throughout New York State to get equipment to facilities as needed. And, you know, we're working as an agency. So we are the state-operated juvenile justice system, but we are under an agency, the Office of Children and Family Services, who also has other human services divisions that are impacted, like child welfare and child care. So we are just tackling things as they come, is how we describe it. But I think overall the staff are doing a great job in trying to really contain it right now.
Incredibly challenging, Inez, to think about the personal loss of colleagues and loved ones through this time. Not to mention the anxiety and the stress of operating in this new environment with the stresses at home, teleworking, the various dimensions of stress and anxiety of operating in this piece. So really focusing on the well-being, the messaging, the communication to staff becomes critically important. Heidi, can I turn to you? I know that in Illinois, you've had some positive confirmed cases of staff in your department as well. Can you talk a little bit about how you're responding to that staff well-being piece, that staff stress, anxiety piece?
Sure. Like you said, we have had a few positive staff cases. I think we're at 11 total now throughout the state. We don't have any youth who have tested positive. We've kind of tried to tackle sort of the anxiety and the staff well-being from a number of different angles. The first piece is communication. So we, just really understanding that during this time of crisis, it's more important than ever that we have very clear communication with as many people as possible and a very clear plan for getting communication out to everybody who needs it. So we've put in place a couple protocols. We have sort of a command center, part of which is set up in my dining room for my remote days, which also doubles as a sewing center. But we do team huddles with our COVID response team twice a day at 8:30 in the morning and 5 at night. And then we do a daily briefing with all the facilities at 11 a.m. That daily briefing is an opportunity to get all the department heads of all the secure facilities and aftercare all on the phone together. We announce any new operating procedures that we're going to be pushing down during that call and give an opportunity for people to ask questions. And then we also just give reminders and updates to folks every day during that time. That's just a general communication strategy. We also have put in place communication strategies around positive cases. So when we are notified that an employee of ours has tested positive, what we do is we have kind of a two-track communication system. For anybody who may have been in close contact with that employee, we go through contact tracing, we work with our Department of Public Health, and we directly notify all of the staff who may have been exposed. If there is not a risk of sort of direct exposure or close contact with an employee who tested positive, what we do is send a memo out to the whole facility where the employee worked and just notify them that there has been a case so that they are in the know about it. What we have found in the first case that we had and the first case that we have in any of our facilities, we go and go to all the roll calls so that we can announce it and talk to staff about it, try to walk around and talk to everybody who's on site and working. Then we send the memo out to everybody. We also try to do that ahead of time so that people would know what to expect. So we said, if there is a case in your facility, this is what the communication chain is going to look like. That's just the communication piece. The second piece is really making sure we're available, making sure people see us and can ask questions. So I have a small group of the COVID team that are assigned to facilities. We go out to the facilities. We try to be in a facility, at least one of us, just about every day. And we're there answering questions, talking to kids, talking to staff, checking in. We also have done a number of things really to try to recognize the just amazing, heroic work that people have been doing during this crisis. And so every day during our 11 a.m. briefing, we recognize MVPs from across the state for the day. They're nominated by their peers, by folks in the facilities, and we send around department-wide really just information and kudos for those MVPs. we try to send out as much information as we can department-wide. A couple other things we've done are setting up trainings. We have a lot of staff. I know I'm talking a lot, but I will back up and say a big thing that we did up front was think about load management and think about the fact that staff, as we go forward, may have to be home for various reasons, that we may have staff testing positive. And so we put our program staff on a 14-day rotation so that we would have folks remote at the beginning of the rotation and have folks on site. And we would be able to switch after 14 days and hopefully have sort of a batch of fresh staff who we knew were cleared to come back to work at the end of that 14 days. I think staff have found that to be really supportive and helpful because we try to be really flexible and work around folks' childcare issues and schedules. And with that, while people are remote, we've been doing webinars, live webinars with some of our partners around self-care, around connecting when you're working remotely, around just managing anxiety. And then the last thing we did, I'm going to do a little demonstration here, but a number of my staff who know how to sew have been sewing and making masks for all of the staff, all the employees, and kids as well. So I'm going to show you an example of one of my beautiful patented masks. But we have a couple people who just really made hundreds of masks, and we've been sanitizing them and providing them to all of our employees. We do have surgical masks as well, but these are just to give people for their personal use. And I think to show everybody that we really are thinking about them during this time and wanting to sort of just share some love in a way we can't. So this mask is based on a nurse's pattern. It goes around your neck like this, and then you tie it like this and fasten it up here at the back of your head, and voila, you have a PPE that you can use when you need to drink or eat. You can put it down, and this one is not going to go to any of my staff because I just put it on my face. But we have a delivery that's going actually today from my house.
That's incredible, and I hope folks were paying attention closely to the themes that Heidi put out there. I think first of all, a testament to your leadership and your team there to be sewing these masks and sharing them with your staff personally. I think must mean the world to your staff to show your level of commitment and dedication there. But for me, one of the things that really stood out in what you were sharing is this importance of communication. And in times like this where so much is uncertain and it seems like information is changing on a daily basis, one of the best things that we can do is to be as transparent as possible and to communicate with our staff, but also with the youth and with families and communities about what we're doing. And so, Brett, I want to turn to you and then to Inez. But Brett, I know that you've been doing a lot on the communication front to speak directly to families, to speak directly to staff and to youth. Can you share a little bit of some of the strategies that you're implementing to describe your agency's response to this crisis?
Yes, Mike, thank you. So kind of from day one, a mantra for me, or kind of one of my guiding lights always is transparency, partnership, and communication. I feel like without those elements, we can't move really any initiative forward. I think it was about day 2 of this crisis, and I was at one of our facilities, stopped by one of our facilities, and the facility director there said, I said, how are your staff? And he said, if I can just be as transparent as possible and sharing with them in a very clear and direct way, they're okay. How about the kids? Same thing. Being open and having open lines of communication for all the way down the line. So we followed some of the same strategies that Heidi mentioned. We also have that similar kind of command team structure where we have a call in the morning, kind of a huddle call, and then all of our facility directors in the afternoon. Then I also have a call in the PM with all of my fellow agency heads. So this is, my child welfare partners, behavioral health partners, service for people with disabilities, so that we can all have this kind of coordinated approach in what we're looking at and how we share. We also recognize that sometimes, as hopeful as I am, so I've really tried to limit the communication in the sense of, I don't want my staff just getting a bunch of blast emails from me. I think anyone who's lived through the last 4 weeks, I think there was a level of fatigue, especially those first couple weeks of the amount of, COVID-related email coming. And so how do I communicate in a way that's actually impactful and useful? So first of all, we use kind of a cascade approach for our staff. So meaning that I don't send a blast email to all of my team across the state. I send it to, the individuals who directly report to me. They then cascade it down. I just do one of those a day with those specific FAQs and protocols that we've gathered through our calls, similar to how Heidi described. When it comes to our families, we have tried, so we've done webinars with our families, just a short message, that's from me. We've also given communication, whether it's, handouts or flyers, different information, pieces of information that we can arm our staff with who are interacting with these families. And ultimately just trying to share the message with everybody that that touches our system. So whether that's our partners, whether that's our families, whether that's their kids, we're committed to treating these kids as if they were our own. And so we recognize that we're having to make some tough calls right now as far as safety. We recognize we're having to make some tough calls as far as visitation, but we don't take it lightly. And we want them to know, so our families, we want them to know that we're going to do everything we can. So if we've got to get them tech, so if we need to get them a smartphone or a tablet, we'll do that so that they can have that video contact. As limited as that is, they can at least have that consistent interaction with their kid. We still allow, someone can still have a visit with a youth, but it has to be staffed on a really case-by-case basis and still following, kind of our really tight screening protocols. But we're trying to be mindful. I think everybody, that's one of the most challenging things for me walking through this pandemic, is this balance of public safety and public health with the humanity of our work, and recognizing that at the end of the day, these are very young people. These are families that are typically in the most vulnerable situations. And what can I do in a way that it's not just this liability shield of how do I just, there's not just one goal. The one goal isn't just protect my facilities. The goal is protect my facilities, but do it in a way that's trauma informed as much as possible. So through those types of approaches, and also we've also done kind of those live webinars, live streams. Sorry, I was losing the term there for a minute. Where we can have similar to this format, where we can have Q&A, where we can have input from our staff, and we've also partnered with our other stakeholders. So I think the first week we did a live stream webinar like this with our court partners, our child welfare partners, law enforcement, and also someone from behavioral health. We have another one scheduled for next week. And all of those things, what happened in Utah that was kind of very fortuitous for this scenario is we've had kind of these ongoing pretty significant reforms over the last multiple years. And the only way you can change policy and change direct partnerships. And so a lot of those mechanisms and formats for partnership were in place, so that now we just had to turn the page and say, okay, now we're looking at this pandemic. How are we doing it as partners? I have a call weekly with the head of our Juvenile Defenders Association. They're the ones, we bounce ideas off each other. How can we limit how kids are coming in? How can we do this? How can we do this? But no one really working in a silo. And that's been huge, I think, for our youth, for our families, and for our staff.
Thanks, Brett. And I think you're right. I think jurisdictions around the country are seeing the investments that they've made in those cross-system partnerships, investments in technology, investments in evidence-based programs and practices are now really coming to be very beneficial in this time of crisis because you can draw on those investments and you've got a starting place for them. And Nez, I'd like to turn to you to talk a little bit about how you're speaking to youth and families during this crisis and addressing some of the anxiety and stress that youth and families in particular are facing.
So as you know, with the impact on facilities, we decided as a team to call our families. And so there were about 8 of us who got all the rosters from the facilities, and we actually called parents and talked to parents, and that included me. And we talked to them about what we were doing in the facilities to keep the youth safe. And many of them had questions. Many of them thanked us for, you know, reaching out to them. They understand the policies in terms of, you know, the closing, the visitation guidelines that we sent out. We also sent out letters to them. Anytime something impacts a family or young person, we either call or send out a letter and make sure that they get the information. I think with the young people in our facilities, they are very knowledgeable of what's happening because their families are also impacted in their communities. One of the things, and I heard a lot about communication, absolutely, I agree with Heidi and with Brett, that is the key. We start out at 8 o'clock in the morning with the governor's briefings, and our commissioner attends those. At 8:30, we have a team of leaders across the agency, and we pretty much troubleshoot issues that we are having. We get our orders, we go back out, we talk about families and parents and, you know, across our system, how do we deal with that? A lot of our families have gotten assistance during this time because they too have been laid off and, you know, they're going through some hard times. So anytime our community partnership people have situations where a family is in need, you know, they go right up the chain, we give them permission and we help them out because this is a tough time for families. The other thing that we do with staffing is we have pre-shift briefings where you come in at 15 minutes before you're actually working, and we kind of update the staff on what's happening. We all send out weekly information. We have weekly meetings with our staff. We're starting to feed staff at the facilities. When people come in, they don't have to worry about bringing in food. We're starting to feed them. The groups with the kids, the biggest, I think, challenge with the young people is the social distancing. That's very hard, and you have to be humane about this, right? And they kind of complain about it, and then they don't understand it, but that's been kind of tough. So we've kind of, you know, rearranged furniture. We've kind of done a lot of different physical things within those facilities to make sure that they don't get sick. I think that one of the things about our system too is that we're small enough so that when we have issues, we can kind of troubleshoot on one facility and send a team out to work on that, and then, you know, we can move on to the next one. But I believe that in New York State, what's been kind of unique is that the directives come from the governor's office and the guidances come from the governor's office to the state agencies, and then we figure out a way to implement. So we're kind of all moving in the same direction across the state. You have that kind of consistency. We've also had early releases for those young people who were eligible. So we've worked with families, and our community staff have done a great job of meeting those families in parking lots and places, you know, where there could be social distancing with their young people. I just believe, and I have to say the same with Brett, that what's hard as a leader is that, you know, you have to be compassionate about what's happening, and at the same time, there's a balance between having to also keep those programs, you know, operating and safe. So we find ourselves kind of doing that and making sure that, you know, we remember that these are people that are being impacted across our state.
Thank you for sharing that. And I do want to just remind our audience that we will be going to a Q&A portion in about 20 minutes or so. So please submit your questions for our panelists here. And as I do want to go back to one of your last points there around examining the population of young people who are in our facilities. And Heidi, I'm going to turn to you to address this first question here. A lot of discussion nationally about the need for being very thoughtful about which young people need to be in the facilities during this time. A lot of movement around examining admission and intake procedures, and as Inez just pointed out, on the back end, thinking about release and reentry. Can you share a little bit in Illinois how you're thinking and how you're approaching this question of that facility resident population? Have you made any amendments to the way that you typically operate, changes to policy and practice, thinking about both on the front end intake and then on the back end release and reentry?
Yep. Thanks, Mike. We have made some changes. I think one thing that has been really fortunate for us at CJJA is that we already controlled the release decision process for kids in our custody. We have indeterminate sentencing in Illinois, and we make the decision about when youth are ready for release based on our own process. So we have always had, not always, but since that took effect in January of 2017, we've always had the ability to kind of look at our population and make decisions about release. So from the release side of things, one of the things that we did right away, kind of recognizing, on the front end that on the front end of this, that we may get to a point where a lot of our staff were not available and were out. What we tried to do is look at the kids who were eligible for release within the next 30 to 60 days. That was kind of our first cut. And we said, like, these are kids that we know are going to be going home anyway in 30 to 60 days. Let's expedite the process rather than having a few go home every week. Let's front load all of it while we have lots of staff that can do it. And let's start there. One of the things that I had in the back of my mind always was making sure that in each of our facilities, we had the capacity to quarantine. So we were looking at all of our population numbers, projecting our population, projecting our outdates for kids and figuring out, what is it going to take in each of our facilities to make sure that we have at least one unit where we can quarantine. So that's been kind of a guiding principle. But also, just starting with the process that we already had and kind of expediting to make sure that we were moving kids out who were going to be released anyway within the next 30 to 60 days. Then after we went through that and we saw where we were at, we started thinking about what are some other ways that we could safely reduce our population. So the next cut was really looking at kids within maybe 90 days of release who had lower level offenses and who have been doing really well, engaging well in programming, who have been, demonstrating good skills, demonstrating appropriate behavior, looking at expediting those releases the same way that we had expedited previously. So that's kind of a process that we've been going through week by week, and it has resulted in a reduction in our population. Like I said earlier, we've reduced our overall population by about 30% during this period. I think the reality is, probably about half of those kids would have been going home anyway, generally speaking, if we were operating normally. The other things that we've done, we've worked with our juvenile detention centers. We do twice a week calls with all of them. We suspended all of our intakes. And I know our governor suspended intakes from county jails to the adult side too. We got just a teeny bit in front of him on that and suspended intakes among the detention centers. So we are not taking new cases in. We're also not transferring kids from our custody back to the county right now. And then looking at our, like I said earlier, a lot of this is load management and thinking about how are we managing load for all sectors of our staff. So as we increase the releases from secure custody, we need to think about how our aftercare staff are managing those cases. They have done an unbelievable job of expediting like approvals for host sites, making sure that they have the capacity to do, we call them curbside check-ins, so that they're maintaining social distancing, but also using some technology to do remote check-ins. And then we also took a look at our kids on aftercare and those that were within about 60 days of their discharge date. And so thinking about load management, we said, are there any kids on aftercare who can be up for an early discharge because they're doing really well, and we can thereby kind of manage the load on our aftercare specialists. So we looked at it from both of those perspectives. We also did get an assist from the governor in Illinois in that he issued an executive order that waived the statutory waiting period when we send out a notice of eligibility to a state's attorney's office, both on the juvenile side and on the adult side. There's a statutory waiting period before we can actually, once we've issued that notice, before we can actually release a youth. And we were finding that a number of our youth were all cleared for release, but for a few weeks remaining on that statutory waiting period. So our governor issued an executive order that waived that statutory waiting period, so that that's not all youth who's otherwise eligible for release. And then, of course, for every youth that we are considering for release, we put in place a new operating procedure, a medical screening. So we have a medical professional do a screening, ensure that the youth is well, ensure that they don't have any symptoms and they haven't had any exposure to anybody with symptoms or anybody with possible COVID-19 prior to release. And I don't sign off on a release. It's been cleared.
Who are in your facilities?
Yeah. So first, not to beat a dead horse, but the importance of kind of like Heidi had talked about, some of those policy changes. So we in Utah have created a pretty high bar for youth to come into a detention. So what that creates is an opportunity statewide. I mean, that's the response when I look at this, of saying, there is these micro on the ground responses I have to make, but macro, looking at how I'm going to navigate any type of situation like this, it's that kind of ongoing infrastructure from a policy perspective and operations that really make the difference. So now in Utah, I have less than, so I do run all of the detention as well as the long-term secure. I have less than 50 kids in detention statewide. So that provides an opportunity where we can make sure that they're safely in those settings. So that's been really important. On the front end, what we've had to do, so looking at detention, we've really had to work with our court partners on trying to vacate warrants. So, if someone has a warrant because they were AWOL, not someone who was AWOL from probation. So working with them to vacate those and working with our juvenile defender partners so that we've been able to kind of do that in a coordinated way. When we look at youth who are on parole or in the community, so those are those who've already been placed in our custody, the decision, to file for a revocation. So parole decisions are ultimately made by our youth parole authority. So they're the ones who would ultimately decide, are they going to revoke or not? But my staff are the ones who make the recommendation. And so we've really tried to, we've had protocol for a long time of saying those decisions have to be staffed up through supervisors. And going through this, that is one of those takeaways, going forward. I've elevated that quite a bit to who has to sign off before they make that recommendation for revocation. And I don't think that's something I'm going to change, you know, regardless of where this crisis goes. It won't be to my level as far as making a decision on revocation, but it could be pretty close. I really do. I think our population is small enough that it could be a pretty senior decision maker that you know, has a greater feel and more experience of what the system can offer to help a youth either return to their placement where they were at or continue to thrive in the setting they were in, versus just kind of the traditional, you know, they went AWOL for a weekend, we're filing a warrant. Like that practice can't continue. We see why it's a problem in a situation like this. And so those are things that we've had to navigate, and our partners at the Youth Parole Authority have been tremendous. And again, you know, kind of cleaning house internally of saying, okay, here's the barriers, here's the constraints we're going to continue to put in place on our system that minimize our ability to take kids out of their home schools and communities. So that's a discussion before COVID. That's a discussion during COVID. That's a discussion post-COVID. It's not going to change. I have to find ways to continue to serve kids where they're at.
All right, thanks for sharing that, Brett. And I keep coming to this idea that this crisis is opening our eyes to possibilities around policies and practices that perhaps historically we didn't think existed. And your focus, you know, your example on taking a hard look at how we approach graduated responses, the use of responses to technical violations, and really being thoughtful about our responses in that way is really coming to a head now in this current environment. And I think the question would be, how do we sustain that over time? So I hope to come back to that later in the discussion. I do see a lot of the questions are coming in, which is wonderful, folks. Keep sending them in. We're going to open it up for Q&A in just a minute. And as I do want to get your thoughts on this question of examining the population of young people in your facilities. What is that conversation looking like? You touched on it a little bit already about focusing on that release piece, but anything else that you want to add to the conversation?
Yes, we are also responsible. We can authorize releases in our system. So we looked at 90 days, the next 90 days, how many kids were eligible for release, and each facility has what we call a release roster, and it's color-coded. Green is kids that already have been, you know, in our system, have done well, have the resources, have a viable release site. And yellow are kids that are they're working on either services or a release site. And then the red are kids that are not ready to go back into the communities because they're a risk to public safety. So we have that list, and what we did was we actually worked with the community side and the facility side to determine what kids we could release. And we actually released like 21 kids in March. We're releasing kids daily, and we're working with families around those releases. We are not bringing kids, the community teams are working real hard not to bring kids back into the system unless, you know, they've done something egregious, like they've committed a crime or something like that. But we are working, especially at facilities that are impacted, to lower those populations so that then we can cohort units and we can quarantine units to stop the transmission. And that's our strategy in terms of our facilities. But we have been, you know, very fortunate that the team on the outside is working very hard to make sure that the services are there, because there are some service agencies that are not taking new clients, right? There are some service agencies that are also closing, you know, in terms of their ability to provide services because there is a stay-home order. So we're working very closely with the community side and the facility side to say, you know, Bobby is ready to go. He has a family resource. We also had the commissioner called the chief judge of New York State to talk to her about kids who were going to get extended. And the facilities and the community staff made a decision and gave us recommendations as to not to extend those kids. So we were able to pull those petitions out of the court system.
Excellent. So let's talk a little bit about the community piece, and then we can go to the questions that are coming in. In fact, some of the questions that are being submitted are related to community supervision and as to your point, the services that are being provided to young people upon release or when they're in the community. Heidi, let me turn to you. When you think about the aftercare piece that your department is responsible for, can you share a little bit about what community-based supervision looks like in this environment where you've got physical distancing and social distancing. Things like how are you managing staff youth contacts, home visits, the use of electronic monitoring, if at all. Thinking about, to Brett's point, the use of technical violations. Share a little bit about what that community piece looks like, first focusing on the supervision piece, and then separately, I do want to probe a little bit about, on the service provider piece, what that's looking like. But let's start first with the supervision. What is that looking like in Illinois?
Sure. Our aftercare team was one of the first groups that we went to a remote work status with. We realized right away, they all have laptops, they all have remote work capability already. And so we realized, right away that was the group of folks we could immediately move into that status. We have been pretty fortunate in working with some of our providers and vendors who have good technological capabilities. And so our vendor, one of our youth tracking vendors was able to push out some apps that we can utilize with any mobile phone. We pay for them, but youth can download the app onto their mobile phone or any mobile device. And our aftercare specialists were able to do face-to-face check-ins remotely that way. It's helpful just because using that technology, they're actually able to put eyes on a youth. They can, in that remote visit, actually ask the youth to show them where they're at, show them the house. Of course, we do have some youth who are not real excited about that application. So for those youth, we have to continue, we can't abdicate our responsibility. And so we are still maintaining some of our core essential services face-to-face on-site, doing site checks. We still do on-site strap tampers with EM, and we are still doing on-site post-site approvals. But our staff are trying to do as much as possible from the 6-foot distance on the curb. If they can look through a window and don't have to walk in the house, that's all right. We also do a screening protocol. So our staff who are going on site, if they are going to be going into an apartment building, going into a house, they call ahead of time and they see if there's anybody in the house who has any symptoms or who has been tested as being COVID positive, and then they will postpone their visit for the quarantine, period. So, it's kind of a mix. It's a mix of sort of trying to maintain some of that on-site. Of course, when our staff do an on-site visit, they have PPEs, and we give them, they have N95 masks that they're reusing as long as they're not soiled. If we have to do a transport, we sanitize and wipe down our vehicles. But sort of like what everyone has said, we are really being judicious about our technical violations. The good thing for us was that we had already, over the past couple years, my deputy of aftercare has really made it her mission to bring down the percentage of kids that we are issuing technical violations to, and really implement graduated sanctions as an alternative to just a straight up bring back. And so we have already reduced our technical violation admissions from 57% of our annual admissions down to 25% of our annual admissions. And that had already been happening. So we already had a pretty robust kind of screening mechanism, and we just leaned into that a little bit more. And I think what I've been encouraging everybody to think about is just weighing the risk and saying, is this kid such a risk to public safety that it's worth potentially exposing our staff and our kids in facility to COVID-19? Where is the risk calculus there? Where's the balance? We have had to bring a couple kids back based on really risky activity, but for the most part, an AWOL situation is not one where we're going to say immediately, automatically that youth has to come back unless we know that they're engaging in high risk behavior. I think you also, so, that's kind of the decision-making process. How it looks is it's kind of a mix of remote and on-site. And then you asked about our community partners. I know that this has impacted some of our partners. Some of our placements are not taking kids. It's actually surprising to me how many are still willing to take kids as they're coming out, although we communicate very, very closely. And so they're very aware of our medical clearance and screening protocols. And the truth is, a kid coming out of my system is probably safer than a kid coming into a placement from the community, because they haven't been exposed to the general public. Screening everybody who's come in for 3 weeks now. We have a lot of providers who are starting to get really creative with remote services, checking, mentoring, remote mentoring, online mentoring, just kind of providing services to kids, to families remotely. Sort of to Brett's point, these are some things that I don't want to end when this, although I want this COVID-19 pandemic to end very, very much. And I'm going to have a huge party when it's done. And I'm going to hug everybody I see, like, all the time. But there's a lot of things coming out that I don't want to end. And I think some of the creativity around remote mentoring, remote services, even, we've started to do remote, like, Bible studies and church services in our facilities. And I think that's stuff that is really going to enrich our practice as we move forward.
Great. Brett, can I turn to you? Thank you for that, Heidi. What is it looking like in Utah in terms of the supervision piece, but also the services? And if in your response, we are getting a question from an attendee here who's asking specifically about the school piece. And given the importance of connecting young people to school upon reentry or upon community placement, what is that looking like now that, many places schools are closed, and what kind of impact are you seeing as a result? So supervision, have you made any amendments to the way that the community supervision is typically done? And then the service provider piece, and specifically the role of education. If you could hit those points, and then Inez, I want you to weigh in as well, if you'd like.
Okay, thank you. And I'm ready for a party as well, Heidi. So first of all, on the community supervision, very similar to what kind of Heidi described, and so I won't spend a ton of time on it, but same thing, we more visits in general, so knowing that, they can use a video type platform if needed. So, but also recognizing that for many of our youth, in many of the situations, especially those first 30 days transitioning youth, they need eyes on. And so they're following the same protocol. We have kind of a little handout. It's a little walkthrough, a flow chart, as it were, of, okay, here's how you do the visit. Here's the questions you need to ask. Here's the distance you need to take, just things like that, but still trying to get out and being present in the community. And that's true, not just for our supervision kids. We're also doing that we have a lot of early intervention, what we call youth services. And these are typically kids who, they often, we take them, we've been taking lunches out to a lot of these kids. These are kids that when they would come to our multi-use facilities, that's where they got, food, that's where they got school. And so we've had to be thoughtful about all of those things. It's saying, okay, we have some of these kids that they don't have other resources. And so we can safely still engage in making sure we're having that interaction with them. So on the service array, there's two things that I feel really fortunate about. Our department, we did invest in a pretty robust telehealth platform. This was probably about 2 years ago, and we made it available for all of our providers. So all of our providers have HIPAA compliant telehealth platform across the state. And now many of them, we didn't utilize it, to the point we do now. And so again, that's one of those good lessons learned from this. We had the infrastructure in place. We were able to make that kind of seamless transition. And now in like a lot of our rural areas, they're hours and hours from, Salt Lake and the, urban centers. We can make sure we still have some of that evidence-based practices going forward, whether it's kids, at risk of coming into our care or kids who have transitioned out. Looking specifically at school, that has been a challenge in the sense that we don't run our schools. We partner with our local educational authorities, and they're tremendous. We have tremendous partners. They have stepped up, and until very recently, they were still holding live classes in a lot of our facilities. That is all stopped at this point. That's based on governor's orders, but they're still holding virtual interactions and trying to have class time essentially where they can still engage with the youth. As a youth transitions out from one of our facilities, we do have what we call educational transitional specialists that help to ensure that there is that connection with the local school district and ensuring that, like I said, my wife's a high school teacher, and it's just not easy right now for, kids. Some of the kids can engage and do pretty well, hopping on a Zoom chat, and we'll make sure our youth, as they leave, that they are connected with who their local school district is. We'll make sure they have the appropriate technology, whether that's a smartphone or a Chromebook. But some do struggle with the lack of in-person. But I've been humbled and just so impressed by the work of teachers across our state, the way they've, gone above and beyond to try to stay engaged with kiddos. And I think that's probably true for Heidi and Inez as well. So those are kind of some aspects related to education. Again, and last one quick thing on the providers aspect, community providers. We are also looking at doing some sustainability. So some grants and different funding to ensure that continuum stays strong and robust, because a lot of them are facing really challenging times.
Yeah, and thank you for that, Brett. Really great information. I think everybody is just having to be so creative and flexible in the way that we meet the needs of young people and families, and that includes our educators, as you say, and our providers as well, in addition to our own agency staff and partners. Inez, what would you like to add to this conversation about how you're thinking about the community supervision and service provision?
So we track our incidences in the community and in our facilities, and the community incidents, the reportable incidents, are way down. One of the areas that we have to struggle with, and I'm glad that Heidi said they thought about people working remotely before. We did not. So it's been very difficult for our community staff to really continue all of the work that they have to do. However, they are working, they do EM hookups, they go to the office if they have to, kids who are released, they participate in courts, but they're doing it all by phone. So as we look at the impact of COVID on us, we have to really look at future considerations for this agency in terms of equipping people so that they can work remotely. That's been one area that we were not ready for. Would you like me to talk about the school too?
Okay.
Okay, and
yes,
in terms of the schools, facility teachers, what they did is, again, we don't have, like most educators are using the Google Classroom and all of that. We do not allow our kids to go on the internet. Our college kids, have specific programs that they work on. And so our teachers are actually bringing in folder works. They're individualized for each student. Once the student runs out of the work, the teacher then comes from home, comes back in, checks the work, and then replenishes those folders. So it's kind of antiquated, but it was the best that we could do with the situation. Again, I think that as a state, we have to seriously look at, how we can equip our staff with the technical, the equipment that they need in case of another crisis, right? In case something else happens. But we are trying to do the best that we can, in our facilities. It's hard to motivate the kids at times because they will tell you, you are not a teacher. So, so we go through that normal stuff, but I think that the teachers have done a good job of coming back and looking at the folder work and giving them work. In terms of getting back to the community staff, I just want to tell you that we also, since we're dealing with this on a statewide basis, we have a lot of emergency operation centers and regional operation centers. So a lot of our community staff and, our agency staff have signed up to volunteer. So people are working like from 8 o'clock in the morning to 9 o'clock at night, and to help out with this crisis in New York State. So I just want to shout that out because I know that some of the community staff are on this call.
Great. Wonderful. So the questions are coming in. We're going to go for another 10 minutes worth of questions from the audience here. We are getting a series of questions around testing of staff and young people in particular, and some of the protocols around that. I know that some of you have, perhaps all of you have looked at the guidance that has been issued by the CDC in terms of the management of COVID-19 in correctional detention facilities. Would anyone like to speak to, and I think you've hit on it in some fashion already, but when it comes to testing of young people upon admission and then testing of staff around COVID, what are some of the protocols that you have in place there? Heidi, do you want to?
Sure, I can start. Well, first, I will say that we don't have enough tests in Illinois to test all the kids, we don't have any kids coming in at this point anyway, but we don't have enough tests to just test folks who aren't symptomatic. So we aren't doing testing on every kid coming in. We're not doing testing on all staff. The tests have become more widely available. So what our protocol has been is if we have either a known exposure or a youth who is exhibiting symptoms within our facility, we immediately put them, essentially we use our influenza protocol. We put them in quarantine. We have sort of two levels. Quarantine for kids who are asymptomatic, who we think may have had exposure, and that's in a separate unit. And then we use isolation for youth who are sick, or if we did have a kid who tested positive, they would go into isolation. We use that protocol, and then if we do have a youth who's symptomatic, we test them, and we follow our Department of Public Health guidelines with that testing. For our staff, the state of Illinois has now made several sites available for all emergency responders, and that includes correctional staff. So any staff at DJJ has access to these testing sites located throughout the state. What we do is if we have a staff who screen out based on exposure, based on symptoms, based on anything, we direct them to self-quarantine and then to go obtain a test. And then they report back to us on the results of that test. And I will say, from my perspective, the things that I think the most effective tools that we've had that we've been able to utilize at DJJ have been screening, cleaning, and social distancing. And so what we have kind of instructed all of our staff to do is that everyone you come into contact with, whether in facility or in community, has COVID-19. And so you should respond as though that person is infected. You should maintain 6 feet of distance. You should, not linger for more than 10 minutes. You should wash your hands. You shouldn't touch your face. We've really hammered on screening, cleaning, and social distancing. And honestly, what we are seeing is that we put in a really aggressive screening protocol right up front, screening people out even if they're a significant other that they lived with was just, displaying symptoms. And at first we kind of had a little buyer's remorse, thought, oh my gosh, we're screening like too many staff out. But I really believe that screening protocol has really kept us from bringing the virus into our facilities. So I would say, while testing is a really important piece, I think screening, cleaning, and social distancing are even more effective tools. When I say cleaning, we clean every 2 hours. We do a full cleaning in all of our units every 2 hours and no less than once every day.
Annette, thank you for that, Heidi. And I think that for those of you who haven't seen the CDC guidelines, really referring to that guidance as hitting the key elements that you're describing of keeping young people and staff safe in these programs. Annette, can I turn to you, and then I'd like to turn to Brett. But Annette, given the number of cases that you're seeing, I imagine that you're also being very aggressive in your facilities around testing and cleaning, sanitation. Describe what it's looking like in your jurisdiction.
So I would agree with you, Heidi. We don't test young people unless they are symptomatic. But in terms of staff, and because of the contact that we've had, we have a whole system where if a staff is saying that they have mild symptoms of, let's say, a cough or a sore throat and all that, we send them out. This testing is problematic in New York State because you can get tested and then you have to wait like 4 or 5 days until you get the results back. We have gone to aggressively looking at our screening. We will take your temperature when you come to work. We will ask you the 3 questions, do you have symptoms of a respiratory infection? Or have you been quarantined? Is there someone in your family that has had a positive contact with COVID? Have you been to the countries that have been identified by the CDC? So we have a system where once a person comes forward and says, I'm not feeling well, I have a cough or I don't feel, we send them home and we say, contact your local DOH, your local Department of Health, and see if, you can get tested. Normally, because of the type of work that they do, people are really good in terms of getting them tested, and then we wait for the results. When those people return back to the facility, we will actually take their temperature and give a respiratory mask. We do have homemade masks, but the governor has ordered us to use respiratory masks only for workers that are in close contact with the first responders and people in correctional and juvenile correctional settings. So a lot of the same kind of things, but we, again, have been a little more aggressive. We're not taking people's temperatures before they come into work.
Great. Thank you for that. And Brett, can I turn to you? I know that in your agency, you developed a set of written protocols as well, available on your website for everyone to see. Can you talk a little bit about those protocols? And specifically, Brett, we're getting a question about contemplating an isolation event. And to the extent that you do need to resort to that strategy, the question is, how are you thinking about who to assign from your staff to that isolation unit? Kind of thinking through the staffing element, the decisions that have to be made with respect to managing that isolation unit. So I don't know if that's been part of the discussion as you've contemplated the protocols, but that's one of the questions that we've gotten here.
Yeah, it is, and thank you. So we, like you said, our protocol doc is online. It's a living document. I'm an attorney by trade, so that was not comfortable for me to say, yeah, let's put this working living document online. But it was a good move, and it's helped again from kind of that transparency perspective. We also too, we've been taking temperatures and screening anyone who comes in our facilities, and it's a very rigorous screening apparatus we're using for the isolation. We again have, really structured protocol on what the difference between medical isolation and quarantine is, and what are all the different steps, to kind of tier into that if we're looking at medical isolation. So far, all of our facilities, we've identified, where medical isolation would occur, what unit would make sense, for if we end up shifting, we had more cases, we would just quarantine in place where they were at, unless we had a lot of cases. Luckily, we have no cases, staff or youth. And then the issue with staffing, so we already went through kind of the exercise and looked at what our shift differential would be. And we have a pretty significant shift differential we're going to pay for those individuals who would be working with direct contact to a COVID patient. I think we're at like $20 additional per hour which is pretty significant based on the average rate of pay for our kind of counselors, frontline staff here, and that'd be per hour. And then also I have what's called, basically program directors, one over all of my secure facilities, one over all my detention and front end, and one over all of my case management. I essentially gave them full authority to, where they need to pull staff from. So we've been pulling, we've had some community staff that have pulled shifts in facilities. All of that, though, at this point has just been on a kind of a voluntary, someone wants overtime. We haven't had an active case. So that's what we're hoping, with the right amount of upfront work, that, it won't be as much of an assigning. There will be those who do want to do that work, and knowing that we would arm them with all of the proper PPE and medical guidance to help care for someone in that place.
So thank you for that. Yes.
Yeah, I just want to add that we also are fortunate in New York State that we have a medical director for the entire juvenile justice system. So he has given us the isolation and quarantine with the team that he works with in terms of what what we should do, but he also determines what PPE is used and when. So it's kind of easy for me to make those decisions, or for my leaders to make those decisions, because he basically has a good grasp of what should be used when.
Great.
This is Heidi. I'm just going to jump in there too and say, fortunately, we also are, we lean really heavily on our medical director, and with every case, no matter what it is, he guides us about testing, about the protocols for isolation and quarantine, about the PPEs that should be used. He's the one who came up with our super aggressive screening protocol, and I've told him now, based on all the good advice he's given us, I think we're to do for.
So I want to get us closer to close here. I do have a closing question for you, and then we'd like to share some resources that we have for the field at CJJR and CJJA. But my closing question for you all, and again, thank you for this wonderful discussion. I know that we just hit the tip of the iceberg in terms of the various dimensions of navigating the impact of this pandemic. But my closing question is this. What you've described in terms of how you, your leadership team, your staff, your partners, how you've been able to be creative and be flexible and to fashion strategies in a way that's focused on keeping young people safe, families safe, staff safe, community safe. What opportunities do you think, as you reflect on, these weeks that have gone by, what opportunities do you think that this crisis presents in the long term in terms of juvenile justice policy and practice? In other words, has this pandemic opened our eyes to possibilities for ways that we work with young people and families that historically we didn't think existed? And what are some of those examples that really come to mind of how you've approached this, that you think you really would like to sustain this in the long term? And I know that some of you have spoken to that already, but would love to get your thoughts on this question as we wrap up. Heidi, I'll start with you, and then Brett, and then Inez. And we have just a few minutes, so I know that's a big question to ask, but as brief as possible.
Sure. Well, I did mention already how I think that some of the remote work that we're doing and the creativity around that presents a lot of opportunity to enrich our practice. Some of the things that I am interested in looking at as we move forward out of this crisis are, a couple things. I think one thing is really how we do training and how we think about staff scheduling. As we've done these rotating schedules and done some training for staff who are in remote work status, it's occurring to me that we could really take a look at how we sort of load manage our staff overall and think about how we schedule folks to be on site and how we schedule training and how we think about going forward using remote technology in order to do that. I think the other opportunities that I really see, obviously, you see the opportunity here for really thinking about the use of secure custody and how we move forward there. Thinking about how we utilize technical parole violations and what we need to do there. And I think also for me, a big lesson learned, or a big thing that I'm taking away, is just how quickly we can put things in place, how quickly we can move when we really need to. And so it makes me kind of think about the degree to which we are not moving quickly in a regular situation, and sort of the bureaucracy and the bureaucratic challenges that we are confronted with, and how we can operate in such a way that we're always moving sort of as quickly as we can, and as thoughtfully as we can within our work. I'm sorry. Last thing I really hope that that I have seen over the past several weeks is just communication and collaboration for us in Illinois, in particular with organized labor. It's always been kind of a fraught relationship here in Illinois, and I've seen some of those walls really dissolve as we realize that we're all in this together. Walls between management and organized labor, but also walls between youth and staff. As we kind of all realize that we're all scared, we're all navigating uncharted waters. And so I think that gives us a big lesson about how we can communicate and collaborate going forward.
Thank you, Heidi. Brett?
Yeah, quickly, I agree, first of all, to the looking at our operations, looking at the bottlenecks, get rid of them. This is forcing us to, so we might as well keep it going. I really think about if we're saying there's certain things we're saying not now, why can't we say that later? So both I look at our front end, I look at detention. Why do we not, our footprint for detention should be much smaller nationwide. And the same conversation's happening in child welfare. They're pausing right now saying, well, wait a minute, I'm not going to remove this kid right now. Same concept. Why wouldn't we just keep that momentum and that eye on policy and disruption post-COVID?
Great. And Inez, take us home. And you're on mute, Inez. You're on mute.
Sorry about that. So I was saying that I agree with Heidi and I agree with Brett in a lot that they said. We definitely have an opportunity to look at remote technology in New York State. We started to Skype with the courts and everything else. Otherwise, people are bringing kids from all over the state to different courts in their communities and everything else. So we're looking at different ways of doing things. But I think that in this experience, we're also going to be looking at our kids differently. And that's what matters. That, there are kids that we looked at and said, hey, this kid can go home. This kid has resources and everything, as opposed to keeping them in the facility because the program runs for for long or whatever the staff has said about the kid. The thing that I see is that there's opportunity in these difficulties, and we have already started the process of our commissioner has sent out a chart with COVID planning and future considerations. So we're already looking at what those future considerations are. Thank you. Trying to talk too fast.
Great. Well, again, on behalf of CJJR and CJJA, let me thank each of you for your contributions to this discussion. I know that folks have found it extremely valuable. We did want to share with the field that we at CJJR and at CJJA on our respective websites have dedicated resources focused on managing the impact of COVID-19. You see them flashing on your screen now. We at CJJR have put together resources for juvenile justice practitioners and child welfare practitioners. CJJA has also created on their page a series of resources, including state-specific policies, protocols, resources that you can take a look at Those URLs are present on the PowerPoint. On behalf of our team at CJJR and CJJA, let me thank all of you again for everything that you're doing on behalf of young people and families and communities that we serve. This is an extraordinarily challenging time, and I know that I speak on behalf of Mike Dempsey and his team to say that what you're doing in the face of this crisis truly is remarkable, and we at our respective organizations want to continue to support you as you navigate this pandemic. So don't hesitate to reach out to us if we can do that in any way. Be safe, be well, and take care of each other and one another. So take care, we'll be in touch, and thanks again for being with us.